This is Pete Moore on Halo Talks. We're going to have a very interesting conversation today with a lens into the future of the Halo sector. We're going to talk about Lionheart Longevity. We're going to talk about certain ways that you as an operator could potentially infuse this into your business through a licensing program. And I'm bringing to the audience today Scott Hoots and Howard Lionheart, and we are going to be talking about how longevity now has a solution. So welcome to the show, guys.
Thanks, Pete.
So Howard, you want to start off here because, we're talking about a lot of patents. We're talking about a lot of proven claims. Maybe some of them are going in and out of the FDA right now or other, government organizations. But talk about what your focus has been through your, life's work and where we are today. It seems like we're on the tipping point.
Appreciate the opportunity, and hi, everybody.
How you doing?
It's always hard for us to tell our story short because we've been at it a long time. Lionheart Ventures, the parent of Lionheart Health and Lionheart Longevity and Wellness, began in 1982. In summary, over 600,000 patients have been treated with Lionheart inventions to date. We have those inventions generate over $1.7 billion in annual revenues with their acquirers. Where we're at today is that back in 1988, we started doing research with a combination of stem cells and bioelectric stimulation to regenerate hearts. We raised and spent over $150 million doing that. We completed and published a pilot, a phase 1, a phase 2, and a phase 3 study, working with over 50 centers around the world, including 33 in the United States, including the top heart failure centers in the United States, Mayo Clinic, Cleveland Clinic, on and on. In 2008, after we did the one and only biotech IPO in the United States in 2008, we split into two groups. We decided to take everything we learned for regenerating hearts or about regenerating hearts, using bioelectric stimulation to control protein expressions and injecting stem cells and support factors. And we put together an incubator that explored whether these core technologies for regeneration could be applicable to anything else. And that team from 2008 till now has developed 38 different applications. And we've spun out a number of those applications to a company called Lionheart Health, which we're talking about today. Mm-hmm. And Lionheart Health, basically, in short, regenerates your body 20 years. And that includes skin, hair, sexual health, joint health, body. That is our goal for our clinics. That is our goal for our products. And we have 500 patent claims protecting that technology, a very unique technology.
Got it. So, and Scott, talk about how you got involved. You and I have known each other for probably more than 10 years now through the franchising sector. What got you excited about this and also the commercialization?
Yeah, Pete, thanks. Hello, everybody. My involvement has come from my involvement in the regenerative medicine space, the franchise regenerative medicine space. For the past 4 years, I've been on the executive team at QC Kinetics, the leading joint musculoskeletal regenerative medicine brand across the United States. Took that brand from zero to 200 clinics in 3.5 years through a franchise model. So Howard and I know each other through the regenerative medicine space. And once I left QC Kinetics in June, Howard reached out to me and said, "Hey, would you like to come on board with Lionheart Health and help us grow this thing?" I think Howard knows, and Pete, you may know just from conversations that we've had over the years. My passion is really all about what I call mission-based franchising, combining the business model of franchising with a business that truly makes a positive impact on people. And in healthcare, we get to do that at QC Kinetics. I was part of a team that did that, and Lionheart Health can take what we did and explode it into something that's even more impactful on the human race.
Well, so Howard, where did the name Lionheart come from?
Well, my last name is Leonhardt, and in the French-German cross language, it means Lionheart.
Oh, okay.
So we decided to run with that.
Gotcha.
We had saw that Lemonade Health had sold to Richard Branson's company, and we kind of rode on that a little bit too.
Gotcha. So, before COVID, there were several companies in New York that were studios that had the EMS bodysuits. that were testing. One of them was on the Upper East Side of Manhattan. They had 6 suits, and they didn't have a great marketing around, what the benefits were, or maybe the business model was not akin to be able to pay New York rents and only have 6 people in a class. So I think there might have been some things that just didn't make sense on the layout of the franchise or the license that they were pursuing. So talk about what you guys have fine tuned, and like, what if I buy a license from Lionheart to become an EMS fitness studio or to become a sports medicine or a med spa? What are you delivering to me, and how much square feet do I need, and how does that business model work?
Appreciate that opportunity. I'll take a first shot, Scott. First of all, we have these 500 patent claims. So our suits and our stimulators are like no other. No one else has those. These have never been used by anybody other than our clinical investigation sites and the licensed locations that we have already. We have a location at 240 West 37th Street, the 5th floor in Midtown New York. Right now, we have Newport Beach, San Diego, and Scottsdale. And we're about to bring on Winston-Salem, North Carolina, and Salt Lake City, Utah, and 124 locations over the next 60 months. The big difference is that we control protein expressions. And maybe coming from the outside, it's a little harder to understand that, but we have the patent for bioelectrically stimulating your muscle to secrete the klotho protein, the follistatin proteins, sestrin proteins, sertium proteins, nanog. For the people that are in longevity and wellness, these are well-recognized proteins that relate to aging reversal. If you're low in klotho, is another way of saying it. There's 3,900 some papers proving this, that you are aging more rapidly than you should. So if you test your klotho and you're under 600 pg/ml in your circulating blood, you're one of those individuals that we all see at the high school reunions that are 60 but look like they're 80.
Yeah.
And if you're high on klotho, if you're 60, you can look like you're 40 and feel and have the vitality of being 40. Those are big statements to say, but you read through the literature, being low on klotho affects every single thing in your body. From the tip of your head, your cognition starts going, your memory starts going, you're more prone to depression and anxiety, you're more prone to addiction, actually. You have wrinkles on your face, your vision starts going, your heart starts failing, your kidney starts failing, your arteries calcify, your blood pressure is higher, much higher chance for cancer, and your muscles start deteriorating. That sounds like incredible, but those are all things that happen as we age. But if you're low in klotho, you're going to encounter all of those things earlier in your life. And what our suit does is the only patented suit that gets your muscles to secrete the circulating klotho and goes into your body. So people enter our clinical trials with 588 pg/ml, and they exit with 1200 pg/ml. 1200 is the circulating klotho level you would have at age 28. And we can do this in people that are age 68.
And then when you talk about protein expressions, tell us what that means. And are you basically saying that with this suit that you guys have developed, that it is stimulating those, or it is propagating those, or is it creating those protein expressions?
The simplest way is when we stimulate muscle or skin, we get the muscle to secrete that protein, and it goes out into your bloodstream. So
okay.
if you were able to visualize it, you would see it seeping out. And we also have patents for stem cell homing. So one of our first patents that was in this series was for stem cell homing. So what that means is when we stimulate your knee, we get the stem cells in your bone marrow, in your fat, and your circulating blood to migrate to your knee to try to repair it. Or if you've had a head injury, we bring the stem cells to your head. If you've had a heart attack, we bring your stem cells to your heart. And in the case of the med spas, we bring it to your skin to regenerate your skin. We bring it to your scalp to regenerate your hair. We bring it to your sexual organ to get the sexual organs to work better. These are a series of things we learned in the early days of regenerating hearts, and now we're applying them to other applications. It's a little bit difficult to follow, but
no, I think we're making progress here.
As you age, you decrease in these proteins.
Yeah, I'm trying to get my arms around it, and then but I'm asking you questions so I understand. Hopefully, the other people in the audience here are understanding the facts behind it, and then how this actually moves through your body. So Scott, from a standpoint of actually starting up a location for this type of service, you've got a lot of groups that are out there doing, med spa. I'm going to put hormone replacement therapy. You got groups on the other side, on the more manual side, that are like CrossFits and Orange Theory and high intensity training. Then you've got doctors that maybe from different types of lifestyles or philosophies that are out there that may be opining on it. And then you've got groups that are trying to sell you Ozempic and Wegovy and lose weight, and that's like so. How do you kind of like parse through all the noise? There's obviously an education component to EMS. There's an education component to your suit, and then there's probably like success stories that you could probably put up on a wall and say, "Hey, look, this is proven. So become a member of my license or my franchise." I don't know if there's a question in there, but feel free to answer.
I'm good at answering non-questions. Here's the thing. Right now, we are at a stage where interested parties in the same space and adjacent spaces are coming to us seeking licensing opportunities. So folks who are already operating med spas or folks who are already operating an EMS studio, one of the franchise brands that you mentioned early on, and what they're seeing, Pete, is they're seeing a differentiation and in an addition to their existing business that can help them take it to the next level and go beyond just aesthetics and get into longevity as well. So that's where we are right now. We have folks who a lot of folks who are interested, but in 2025 when we start franchising, then that'll open the door to the business folks as well, and that's where I bring some experience into healthcare franchising. It's not something that's really easy to do, as you know. It's not as straightforward as opening a Subway. There's a lot of regulatory environment there. So
I got a couple of questions, or maybe I can rifle shot at you guys. One is, if I open up a location, is there a doctor that this is under, or is this a non-doctor related treatment?
In the case of the BODSTEM EMS suit, the FDA has allowed, as long as you have a professional fitness trainer in the facility, that is enough. Perfect. For the med spa, you need a medical director, a doctor. For the sports medicine clinic, you need a medical doctor, and for the vet clinic, you need a veterinarian.
Perfect.
If it wasn't clear before, we sell a one-suite license for $40,000 for med spas, and that requires that they put a little sticker out front, Lionheart Longevity, our sign on the door of our dedicated treatment suite, and then a big sign inside of the room. And they may have other suites in the med spa that do other things, but that suite, according to our license, will be dedicated to us. And we get a 7% royalty on the service sales. So they will sell skin regeneration, hair regeneration, joint health restoration, sexual health improvement, bladder health improvement.
Is this all at the same? Is this all wearing the same suit? Is this one suit that fits all?
Only the suit is only for the fitness studios and for the med spas, but that's just one product. So we have a stimulator for skin, we have a stimulator for hair, we have a stimulator for joint health. It looks like a benchtop device, like a portable computer, and you run electrodes to the knee or to a hair or to the face or to the sexual organ, and we do the treatment in the clinic. And we also have bioelectric enhanced PRF. So anybody coming in, we take their blood, we centrifuge it out, and we inject it in their knees and their scalp, their face, or their sexual organ, and then we bioelectrically stimulate that platelet-rich fiber and unlock and leash and amplify regenerative protein expressions. And then we hit them with a whole series of stimulations. I won't go through all of them right now, but there is about a dozen of them for different protein expressions. And then when they go home, we'll send them home with some things that they can do at home to maintain that. But we want them coming back into the clinic to get the full program. And by the way, we just won the Allergan Aesthetics Innovation of the Year Award in medical aesthetics, primarily for our work in skin and hair regeneration.
Amazing. How much does a suit cost?
The most popular suit sells for $2,495. Of course, we offer financing, and
and how many suits? I'm just going to rapid fire these. How many suits do you recommend if I'm a med spa and I've got a room and I want to dedicate it to EMS and Lionheart technology? How many suits do I need to buy?
There's a couple different ways to go. The professional suit we have actually sells for more. It's $9,995, and we recommend having extra small, small, medium, large, and extra large. So 5 suits. Each professional suit will go up and down a couple sizes. So you can go, if you have a large, it'll go to extra large and medium, and you get the idea. And then you don't have to have such a large inventory. Most of the EMS studios charge a membership model. So it's something like $225 a month for the members, and they can come in and use the suits 2 to 4 times a month, usually for a half hour.
Got it. So hypothetically, let's say I was 52 and I look 35 already. No, let's say I didn't look 35, and I wanted to regrow up my hair. Or I had a knee issue from playing catcher. How long would I become a member, or how long does it take for to see the change, or when is the treatment start and end, or does it ever end?
We consult with everybody coming in to kind of match up with their desires, their needs, and affordability. But most of the trials have been coming into the clinic at least a half hour twice a week for at least 4 weeks.
Okay.
Some programs we go to 8 weeks. Some programs we go to 12 weeks.
Got it.
We just finished a clinical trial for erectile dysfunction. 115 men came in, and they were only stimulated 45 minutes twice a week for 4 weeks. And a year out, they still don't need Viagra. We grow new blood vessels. We regenerate the muscle. We regenerate the nerve in that organ. And after 4 weeks, coming in 8 times, they're good for a whole year. They don't need to use Viagra anymore.
Is there any health insurance reimbursement, or is this all out of pocket?
So far, we're handling everything out of pocket.
Gotcha. Okay. Got it. What else would I need to know if I became a licensee, Scott?
Well, we have data on over 1,000 patients treated with our therapies over the years, and it's building up. We're just about to launch a clinical trial at Cleveland Clinic with Dr. Wilson Tang, the chairman of heart failure. We're going to send half the patients at Cleveland Clinic home with the suit to do exercise with the suit 2 or 3 times a week. The other group we're either going to send home with a placebo or without a suit, and we're going to compare quality of life, hospitalizations, and even mortality if they live longer. We've already done clinical trials, as I mentioned, for erectile dysfunction, for skin regeneration, hair regeneration, joint regeneration. This is a well-tested technology, and backed by a team that has a pretty good track record. Over 600,000 patients have been treated with our inventions over the years, and we've developed market leadership in a number of segments.
Now your company with Lionheart Ventures, you've seeded a number of different companies also, as from the notes I have of 32 different companies. Is there any investment opportunity if I'm a venture capital firm, or if I'm a private equity fund, or I'm a hedge fund that says, hey, I buy into this, and you're basically like, I don't have to pick the winner at the bricks and mortar, or at the customer level. I can pick a winner based on the technology and the patent protection. Are you how are you set up right now? Are you set up to bring in investment capital? Are you not needing of capital? How are you set up, Howard?
Well, like all growth companies in our sector, we're needing capital. We have 2 active offerings of interest right now. One is directly to invest in Lionheart Health. We hope to be in position to be a public company in 2026. We're raising $3 million now at $1 per share at a $27 million pre-money valuation.
Okay.
And our intention is to, get 124 of these licensed clinics set up. By the way, of the 124, 20 will be corporate owned, like the one in New York is corporate owned. 20 will be partnerships, like the one in Newport Beach is a partnership. And then 102 are expected to be licenses or franchises, like we have in San Diego and Scottsdale, and we're about to have in Utah, in Winston-Salem. The other opportunity to invest is through the accelerator, which you were kind of hitting on that. So the accelerator, you can invest in the accelerator. Let's say you invest $100,000. You get $100,000 of the venture studio or the accelerator, and you get a warrant free of charge to apply to any of the 38 assets being accelerated, that you can obtain shares in that individual asset.
Yeah.
So it could be skin stem or hair cell. So it'd be like investing in a movie studio, but you can also get a piece of whatever your favorite movies that the movie studio is putting out. Because if you're familiar with the movie industry, the studio has one set of owners and each film has its own set of owners.
Sure.
And in this case, you can invest in the studio that's making all the inventions, and you can also invest in the individual investments. And you have until December 31st of the year you invested to decide. So you can see if the results with the hair cell study or the bod stim study with Cleveland Clinic are turning out well. And then at the end of the year, you look at what progressed the most, and you can decide to put it all in one. You can say, oh, I want all 100,000 going into stem cell bra, which, by the way, we just finished a clinical trial in Spain. Women who wore our stem cell bra, 1/3 of them increased 1 cup size with just a bioelectric bra that secreted proteins in their breast.
Well,
1/3 of them increased 1 cup size in 4 weeks. 1/3 of them increased 10%. 1/3 of them did not increase. The ones that didn't increase happened to be the skinniest ladies that were in the group. So we've learned with the stem cell bra, a patented technology we have, if the women have a little bit of a jiggle, a little bit of fat to work with, we can increase their cup size, 1 cup size in 4 weeks. And they only wore the bra 1 hour every other day for the 4 weeks. So they didn't wear the bra, constantly, just 1 hour on Monday and then Wednesday. And so if you invested in an accelerator, you can say, hey, I really love these clinical trial results. I'm going to put all 100,000 of my warrant to stem cell bra.
So in closing here, and we could talk for hours, but this should give people enough of a teaser to understand what the potential opportunity and the revenue to put inside of your location, which I think people need to think more and more about their revenue per square foot and what they're offering, and how to synthesize that into attacking my demographic and my base. One question I have for you, Howard, is a lot of what you're doing, and you said since 1982, you're going against some pretty big companies that are trying to convince people, take this pill, don't do this treatment. So you're kind of like almost like on the naturopathic side of like, hey, you want to take Viagra or actually want to fix this yourself? Do you want to, take these, get these shots, or do you want to do this, naturally through my system? Do you feel sometimes like you're like, it's like David versus Goliath, or it's like, hey, I'm punching against people that have artificial ways of solving a problem, where I'm actually going to the source and I'm solving the problem? And over time, people maybe will understand like the efficacy of what I'm doing, and I just need to keep doing it longer.
That's a good question, and certainly is a challenge. One thing that gives us more confidence is I'm now 62, about to be 63 next month. When I first started out, we were definitely the David fighting the Goliath, but we beat the Goliath twice. We developed the first stent graft. Nobody believed in it. It was a completely new invention for repairing aortic aneurysms. We were fighting an uphill battle. All the entrenched large companies that had something different wanted to cut us down and rip us apart. And we ended up leading the market. And today, most of the people in the world that have an aortic aneurysm are, including my father who got our invention, are repaired with our device. It's the leading system in the world. So one thing that builds us confidence is that we've faced these challenges before, and we won on over $1 billion twice before. So we feel more confident this time than we did in the beginning.
Awesome.
In the case of erectile dysfunction, which I mentioned to you before, I'm not going to disparage the name of the company, but one of the leaders in the field that sells pills for people with erectile dysfunction. We had a meeting with them. We presented our excellent results where 100+ patients, we basically cured them of erectile dysfunction, regrew their blood vessels that didn't leak and lasted, regrew their muscle, reestablished their nerve connections, the fundamental underlying cause of erectile dysfunction. And we had histopathology in animals to help support that. And they sent us a letter saying, thanks for showing this to us. This does not fit our business model.
Yeah,
well,
of course it doesn't.
Quickly realized their business model is not for anybody.
Destroys
their business model is to sell you pills. And so, yes, we are fighting that battle. And anytime we start to look like we're going to dent their business of selling pills, they're going to send PR to discredit what we're doing.
Exactly.
It already happened with stem cells, where we were in the pioneering days of stem cells. And all of a sudden, we saw all this negative press about stem cells. And we're thinking, your body is made of stem cells. Your tissue and your heart is made of stem cells. It makes perfect sense to repair them with cells the way they're made in the first place. But yet somehow these drug companies spin the press to make it sound like we're the crazy ones,
I know, right?
and they are, collecting weird chemicals in the jungle,
Right.
and they're considered to be. Now, I don't want to cause a big fight with the drug companies. We just want to, stay our path and prove out with good clinical data that our technology works.
I got you. All right. Well, I think there's an Apple commercial that says, to all the misfits, to all the, disruptors. So count yourself as one of those, and congrats on the success and the research and the hard work here. And it sounds like it's about to fully pay off. So thanks for.
I do want to mention that should be of interest to your listeners. We're an official entrant in the $101 million X Prize competition for health span longevity. And December 20th, which happens to be my 63rd birthday, the final protocol has to be filed with the judging panel. And what we're going to do is people who come into our licensed med spa clinics, the licensees will be trained on this. They'll take a blood sample, a DNA sample. They'll do an oral microbiome test and a gut microbiome, and we'll develop a customized plan to reverse their aging 20 years.
Amazing.
Now, the contest organizers have indicated that they've decided that there's going to be 3 criteria. Whoever does the best in muscle improvement, whoever does the best in brain health improvement, whoever does the best with immune strength improvement. So 3 major categories to judge.
Okay.
So if somebody comes into one of our licensed clinics, they can join that protocol and they can be amongst the first in the world. And we're not only going to be doing the bioelectric stimulation for the people that stay in the U.S., but we have a satellite clinic in Cabo San Lucas that with Dr. Patrick Sewell, and people can go down there and get genetically modified clotho-expressing stem cell infusions and injections, and they can also get a gene package injected into their thigh muscle that causes the overexpression of clotho, follistatin, and TERT. If you're not familiar with those terms, basically, these stem cells in these gene injections are designed to reverse your aging 20 years. Now, we're going to have one path that you don't go down to Cabo, you just stay in the U.S. In that path, we'll just bioelectrically stimulate you to get these proteins. And if you want to be more risky and join a clinical trial, you can go down to Cabo San Lucas and get the advanced program.
Sounds good. I might be one of those clinical tests. So appreciate you guys coming on. Good to see you. Great work, Scott. We'll be in touch on locations to hit for leads.
Awesome.
Appreciate it.
Thanks so much for having us.
Thanks, guys.